morning, everyone. Good morning. Welcome to Sanofi's booth. Very excited to start the day with our first session. And we will talk about the holistic and pervasive adoption of AI at Sanofi. And for that, please welcome the Global Head of Data and Artificial Intelligence at Sanofi, Kaoutar. Sghiouer.
Good morning, everybody. How are you today? Because I'm very enthusiastic and very happy to be here to share how Sanofi is deploying AI in a scaled manner. So let's move. But you know, in our life, everything has a triggering event, right? For us, it was that one. So we can't hear Paul.
At scale.
Yeah. So we can't hear it. That's technical issues. But he said in June 2022 that we want to be the best biopharma adopting AI at scale. And what does it mean for us? 4 elements. The first one, it was we need to simplify it for everyone because it's for every Sanofian. Not only the data and AI expert, not only some specific business, but for everyone in Sanofi needs to understand AI, need to play with it, need to use it day to day. So that was our first element to start adopting AI at scale. Then we moved to adoption. And adoption, it's ways of working, it's products that we are deploying from research, development, manufacturing, supply, commercial, corporate function, and of course, patient care. So, and then when it's adopted, then you can move to acceleration. Then you can move to anything that we have that contribute to reduce the timeline from discovery to therapy. It can use AI. So, but for us, it's not about a hype. It's not about, okay, AI, everyone is talking and using AI in this world. So we need also, for marketing purpose to put AI. It wasn't our purpose. Our purpose is patient care, and we wanted to sustain our AI product for long term, not only for the next 2 years or 3 years. Because I think, if you don't know, the timeline for a molecule from discovery to therapy, it's about 15 years. So let's now to move a little bit and to deep dive on how we did the simplification. First, we split AI. I know it's not in the state of the art, but it's our definition of AI in Sanofi. 3 clusters. The first one, it's expert AI. As we just saw with Emmanuel and on stage, so he mentioned that we are using AI for manufacturing, expert AI. Then we have the snackable AI. Actually, it's a word invented by our CEO, so the same one who said we need to adopt AI at scale and being the best biopharma company using AI. So he invented the word of snackable AI. It's like snacks. So for every day, for everyone, without being really data and AI expert. Then we have the cluster of Gen AI agents. It's not another, I would say, type of AI, but it's just a simplification for us. Because if you remember in 2010, all companies invested $1 in AI, they lost $4. And it was the opposite that all advisors, they promised it. So we want really to put Gen AI, we want also to use it and to scale it because it's an opportunity for us as for any company, but we are taking it truthfully and carefully. That's why we put it a little bit aside of expert and snackable AI. And of course, we are a biopharma company. Most of our data and sensitives. And we can't have a lot of bias, and even we need to avoid bias, even not only with data, but also with AI. That's why we have raised responsible AI at Sanofi to ensure that all our AI products are robust, secured, sustainable from an eco perspective, but also it's respecting the ethics and people life and people intimacy. So that was our simplification approach that we put in place. Once it was understood, because to do that, last year, for example, we had a month, the INAI month for all Sanofian, where we had several booths, several webinars, several upskilling, training, that AI can be understood by everyone in the company. So moving to adoption, it's about the usage. If you remember when we were at school several years ago for me, because I'm not too young, so we had what we call the theory when you had your class, but also you had the experimentation to ensure that you understand what you are doing and to understand your courses. For us, that was the key. It's to allow all Sanofian to use AI day to day. And we have concierge. You can have a visit there. And it's a product for us. It's for all Sanofian connected to our internal data. They can book meetings. They can summarize documents. They can analyze them. They can, have any information related to their day-to-day as a Sanofian in just a button click. It's like our LLMs, GPT, I will say, customization that we put in place for all Sanofian. But it's not only for, I will say, corporate purpose. It's also for R&D purpose. We can do some data discovery on it. We can also have behind that some AI agent in place. So you can say it like a conciergerie for everyone, for every domain, and that's really part of the adoption. We have also another app, Play, that we built with our partner Ali Lab. The booth is here also. If you wanted to have more information, the idea is to have a forecast of resource allocation, of investment on each domain every day, every second, every minute. So that's I will say, the ways of how we scaled adoption. Performance is huge. So 80% total workforce using at least once concierge today in the company. So, and we have 90% positive feedback. And I can tell you, with my approximately 15 years experience in AI, it's so huge to have such number and such accuracy. So more than 200,000 documents summarized in the tool. So, of course, when we are adopting AI as an employee, we need to see saving in terms of time. And we have about 2 hours saving in average per week with concierge, which is huge for an employee and for expert domain. So, embracing AI truthfully, responsibly. Again, we did a lot of upskilling training on how you can build your AI product responsibly, how you can respect, of course, regulation, how you can respect GDPR and all the regulation that we can have. So a lot of Sanofian trained on expertise, like you see here for GenAI, 7,000 Sanofian trained there. More than 96,000 Sanofian trained on generalist, or what we call snackable AI. But of course, great to adopt, but we need to accelerate, even when we have such car in the booth, right? But it needs to be also an acceleration day to day. So we have a bold ambition. Our ambition is to halve time from discovery to therapy. And we want to be the best biopharma company powered by AI at scale, so it needs to be everywhere. That's why we have another ambition, which is to contribute significantly that on Sanofi growth with 50% of resource allocated to innovation. Huge ratio, important that your 50% resource are allocated to innovation. So the schema that you are seeing here is the same that we have in the booth. You can discover everything by just moving on the booth and seeing all the demo on such product, because I can do it, but I don't have enough time to go through every element from academic research, target identification and validation, drug discovery, clinical trial, market access and launch, commercialization, and of course, HCP engagement, patient engagement, post-marketing surveillance, and employee experience. So everything here is today powered by AI at scale, and we have a concrete demo here for each element of that. So now let's move a little bit to the hype of Gen AI. But again, as I told you, we are not only following the hype. For us, we need to have concrete action on the product and concrete outcomes on the product that we are deploying in Sanofi using AI and data. So Gen AI, it's about content generation, summarization, but also it can be data creation. So we split several elements that are, I will say, important for us. Conversational one, the document, of course, content generation, voice, image, text, and of course, data-driven decision support. As I mentioned, Gen AI, it's also about having synthetic data. And what else? When you are working for a biopharma company, you can't do only commercialization. You need also to do AI for drug discovery. But what's really important for us, and what's maybe a little bit complicated from other industry, where you can see the value of AI quickly, what we call in industry is quick win. For Sanofi, yes, we have the quick win, for example, with the HCP engagement, patient engagement, commercialization. But for the part of drug discovery, we are, of course, using AI. But we need to be honest. To check, you need to wait that you move from phase 1, 2, 3, and to have it in the market to see that it works. That's the complexity that we have as an industry, as a company, to build our drug discovery using AI at scale. So that's why the strategy is, of course, to have the quick win and to have the long-term vision. That's why I mentioned it's not only about a hype. We are a believer on the technology, and we are adopting it at scale, and we are accelerating it. So we built our Gen AI platform, of course, using the whole ecosystem that we have raised that I mentioned, but also our data mesh to be secured and to be AI-ready data. So because AI or Gen AI, it's not so magic, you need to have your data ready to be used and pre-processed by AI. So we have, of course, a Gen AI platform where we built all the ecosystem, technical ecosystem, to allow the product to run and to be really a product and to work. But also we have some product line who are using the commonalities that we built on the platform to benefit from everything that we built for R&D or M&S or commercial between all functions. So now let's move to the agent. The definition that we have, and also taken from the state of the art, it's of course something that use AI to be more autonomous. But to do that, it's an ecosystem where they need to observe. So your AI model built on the AI agent needs to have this ability to observe, to analyze the context, like us as a human. When I'm looking to your face, I can say, okay, who is happy with my presentation, who is not, who is still to be a little bit bored. It's the same for the AI agent. They need to analyze this context, to observe it, and then they can take action responsibly and truthfully and acting. But acting, of course, when you have your AI agent, you can turn your threshold to be more autonomous, 100%, 80%, 70%, because again, it depends on the topics, it depends on the I would say the insight or what will be the impact of this AI product. So our value chain, of course, we are using today the AI. So we start to use Gen AI and thinking about the AI agent for literature insight generator. Literature insight, it can be on R&D, but also it can be on M&S, it can be on commercial. But that's one of, I will say, of the common use case. Of course, supply chain for shortage detection, for example, and taking decision on that. It can be also on market access, like tender insight generator, but also corporate function. I mentioned concierge. We have some AI agent behind concierge who can take action. Like, for example, booking a meeting with the CEO of the company. I can use concierge. No, don't believe me. It's not so easy. Of course, it's for sales rep and marketer. Today, they can have insight and easy decision to take using the AI agent and Gen AI. And of course, when you see this chain, again, when you will follow the visit of our booth, everything is connected. It's not incremental. All these AI are interconnected, and the AI agents behind that, they are doing this connection to make the right decision. Remember the observation? They are observing everything here to make decision for every element on the right moment with the right level of accuracy. So, but when you see the AI agent, and when you see at the end a product like Concierge, it seems to you so easy to have or so easy to develop. Yes, it's so easy to use, but the development of an AI agent, it's so complex, especially for a company like Sanofi, where we are using sensitive data. So, of course, we need to ensure that the life cycle is well managed, secured. The data are AI-ready data and respecting regulation, respecting internal process, and respecting all rules that we can have, that the AI itself, which is by design increment bias, we need to ensure that these bias are decreasing or at least detecting the bias, to avoid the threshold of 100% of autonomy of the AI agent. So, well, once we did that, we can't play with it and use it, adopt it, and scale it without clear governance. So we have a clear governance in place to ensure that, as I mentioned, our data is ready, but also all the process are respected. But more than that, that there is a value. Remember, it's not about hype, it's about patient care. So every product deployed, we have a governance first to allow the product to be developed before that we moved to deployment. So we have approval, and we have a Gen AI agent board with XCOM member. We have a meeting every 6 weeks to ensure that we have the right product developed in Sanofi. And I will maybe go a little bit outside of my expertise inside Sanofi and being the AI expert outside of it. And coming back to this board meeting every 6 weeks, for my 15 years experience in company, I never have seen that. So, which is huge. That means that the CEO is involved. He was the one who launched this marathon of AI in the company, and we have XCOM involved day to day in AI product validation and ensuring that we have a value, we have an outcome, and we are not doing some toys and mushroom everywhere and hyping with everyone. It's about insight for patient care. So I talked a lot about concierge, about play, and more about the snackable AI. Let's have a look about the expert AI. So for drug discovery, we can have 2 patients. But 2 patients, they can react differently to the same molecule. So using AI on that, it's about combining data internal, external data, you know, the real world data, but also synthetic data, having insight from the past that we had with maybe some molecule equivalent to that one, or some reaction that we had in the past, to predict the patient response. Just take a second and think about it. Imagine today we are doing drug discovery and we can predict the patient reaction. Imagine how much time we can save, how much life we can save by putting quickly in the market this molecule. So, of course, we can identify high-risk patients earlier. We can optimize treatment strategy, and we can push the boundaries and push forward the precision of medicine in immunoscience. So, wonderful, I will say, purpose and wonderful outcomes that we can accelerate and have with AI. So, what about sustainability? It's not about the eco-sustainability only. It's about the sustainability of AI itself. Because the idea, it's not building a product that works and then we can forget that one and move to another one because we have another hype. Today is Gen AI agent. Tomorrow it will be something else. Maybe the quantum will be there. And it's, again, I insist on that, it's not about hype. We need to sustain everything that we are building and to sustain the journey to our 2030. It's not about 2 years, it's not about 3 years. It's about a huge and long horizon, and to launch our molecules and priorities assets, we are focusing on first modernizing, you know, our ecosystem, but also having a believer in the company. Having one team who is working for one purpose, which is reduce the timeline from discovery to therapy. Everything we do, it's linked to that purpose, even meetings. So, to do that, as I mentioned, now we have this adoption, because 2 years ago we started this journey. We are in the phase to ensure it's not only about execution, because we have a lot of product that you can, again, see on the booth, but it's about sustainability, how we can sustain this journey to 2030, continue innovation. Remember the 50% of resource allocation on that. So we are keeping data by design and AI by design and outcome by design. So 3 key elements to ensure that everything we do is done truthfully, responsibly, with a clear outcome for the patient. So our data and AI principles are 9. You can see in the market 3, but for Sanofi, 9. It seems maybe so much, but when you look at it, it makes sense, because having data by design, AI by design, to ensure that we have a speed to value internally for our partners. So as a data and AI organization, we need to serve all businesses, all Sanofian, and we need to speed to market. Remember the molecule from discovery to therapy quickly and safety. So 9 AI principles. Strategic alignment. Remember when I mentioned the platform? Commonalities. We need to have commonalities to avoid, you know, several investment or several research in the same area in the same time. That's really a benefit for us, that we need to have a strategic alignment. Accelerate data discovery is everyone in his domain can be able to access his data and can know also what's data available in Sanofi and what data that we have or we need to have or to buy. So accelerate the AI readiness. Remember my statement about investing $1, companies lost $4? So here, if we are not AI ready data, no development. So that's one of the principles. Of course, we need to ensure reusability, especially when we have an horizon for 2030. Everything we build, it needs to be reusable, it needs to be valid and flexible too. And we need to ensure the innovation at scale because, as I mentioned, today it's about a hype of Gen AI agent. Tomorrow is something else. But as we are building our ecosystem, it needs to follow all the innovation coming in the future. And of course, the value realization. That's why we are tracking, in the same time that we are developing our AI model, we are tracking the value every sprint. So, AZ, data, and AI experience. Because I love AI, I am an AI product, I love data, but it doesn't mean that everyone loves data and AI. So that's why the user experience is so important, and that's why we had today some product to showcase because of that, because we thought about, okay, what can be the user experience of this data and AI product? Again, governance by design, because we are managing and using sensitive data, and what is really important is foresight, a strategic foresight for all Sanofi and for the product that we are developing. But one thing really important for us, and that's our philosophy about data and AI, AI won't replace human. Everyone has a space in this life. Every human has a place to be in this new world of data and AI. But the human using AI will, of course, replace the human not using AI. Thank you.
Thank you. Thank you very much, Kaoutar. We're very happy to know that AI won't replace human, as far as I know. Do we have questions? We have a couple of minutes for questions. Don't hesitate to raise your hand if you have any question. Well, in the meantime, I do have a question for you. You're investing very much on AI, obviously, to chase the miracles of science, to improve people's lives. How can you ensure that all these AI investments are worthy?
So key element that already I mentioned in the presentation, it's before starting developing Gen AI agent product, we need to follow the governance with some ExCom member involved there every 6 weeks who are taking care of validating what product is really valuable, linked to our purpose, and feasible. Because you can have a lot of dreams and you can believe that AI will execute all your dreams, but reality is AI, it's not so magic. It's about the data, it's about the content, it's about adoption, it's about the simplification. That's some keys that needs to be respected and to be there. And because we had in mind this, the $1, we lost the $4, said, okay, we can't do the same mistakes that was made in the past by some companies. We need to ensure that what we are deploying, it's really valuable and valid. So I will say, by design, we are ensuring that the outcome is there.
Well, that's good news. Do we have any other questions? In any case, you're here, Kaoutar, with us. So if you have any questions, please reach out. Thank you very much. A great applause to you. Thank you. Thank you, Kaoutar.
Thank you.
Thank you very much. So ladies and gentlemen, we'll have another session in about 15 minutes. Don't hesitate to visit our booth. We have an R&D, research and development corridor over there. Very interesting to see from research up to patient how things are going. We also have a fantastic McLaren car, racing car. Please don't hesitate to see how our partnership is, how this partnership is working also for Sanofi. Enjoy. Have a lovely, lovely VivaTech. Thank you.